Bonjour et merci de vous être.
Good afternoon, and thanks for joining us today. I'd like to start by taking a moment to wish every father in Canada a happy Father's Day. I'd like to pay tribute to every dad and every granddad, including my own, who we can't kiss or give a hug to because of physical distancing. We love you very much. I'd also like to thank everyone across Canada who's working so hard behind the scenes to organise our daily press conferences. And by that, I'm referring to the technicians, the simultaneous interpreters, camera people, sound technicians, those who look after cleaning the rooms, and of course, journalists and reporters. Thank you for everything that you do.
By wishing a very happy Father's Day to all of Canada's fathers. And I'd like to offer a special shout out to all of the fathers and grandfathers, including my own dad, who we haven't been able to see, hug and kiss in person because of social distancing. We love you very, very much. I would also like to thank everyone who works so hard behind the scenes to make these noon press conferences possible. Our technicians, our translators, camera operators, audio technicians, the people who keep this room clean and safe for all of us, and of course, the journalists, although I don't expect you to ease up on the questions, okay? Thank you for everything that you do and have done over the past months. So today we're going to hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer of Canada, Dr. Howard New, and of course, I'm also available to answer your questions. Dr. Tam, please.
Thank you. Bonjour, bon après-midi. Thank you for the reminder about Father's Day. So I'll just take this moment. It's not seen since before Christmas. So here are the latest numbers for COVID-19 in Canada. There are now 100,220 cases, including 8,300 deaths. 62,496, or 62%, have now recovered. Labs across Canada have tested over 2,295,000 people for COVID-19 to date. Over the past week, an average of 36,000 people were tested daily, with just over 1% testing positive. These numbers change quickly. Please check them on canada.ca/coronavirus. It has been 100 days since Canada reported its 100th person with COVID-19, and we now have over 100,000 cases. This is a moment to reflect. Over the past week, we saw an average of fewer than 400 new cases reported daily, which is less than a quarter of the epidemic in late deaths reported daily in early May to an average of 39 deaths reported daily over the past 7 days. Our collective hard work is paying off. It is encouraging that we are observing declines in case counts across all age groups in Canada, and that the steepest declines have occurred among the oldest age groups, which are most at risk for severe outcomes. Going forward, a top priority for Canadians of all ages must be rising in groups, all of which will increase their likelihood of coming into contact with the virus. And while younger people may not be getting as sick, it doesn't mean that they're not capable of spreading the virus. Everyone needs to be aware that no one is immune to serious illness with COVID-19, and anyone can spread the infection, exposing and endangering the lives of others. The virus is still circulating in Canada, and new cases can emerge in any part of the country. As we head into another weekend, I urge Canadians of all ages to go out smart. Outdoor spaces are better than inside, less people better than more, and frequent hand washing is a must. Wherever you go, keep your 2-meter virtual bubble for optimal physical distancing, and wear a mask when and where you can't keep that distance. Thank you. Merci.
Okay, thank you, Dr. Tam. Et maintenant, je donne la parole à Dr. Howard New. Dr. New.
Dr. Howard New, the floor is yours.
I think I will give a shout out to my kids, Nicolas, Mathieu et Sandrine. Je vous aime beaucoup.
Nicolas, Mathieu, and Sandrine, I love you very much, and I'm sure you won't forget me on Father's Day. Now, let me start by giving you the most recent numbers on COVID-19 in Canada. There are now 100,220 cases, including 8,300 deaths, 622,496, or 60% have now recovered. Labs across Canada have tested over 2,295,000 people for COVID-19 to date. Over the past week, an average of 36,000 people were tested daily, with just over 1% testing positive. These numbers change quickly and are updated daily in the evenings on canada.ca/coronavirus. As we head into the weekend, having now reported over 100,000 people to date with COVID-19, let's reflect on where we are now with a look back at this week in numbers and what that means for Canadians. Over the past week, we saw an average of fewer than 400 new cases reported daily, which is less than a quarter of the over 1,700 cases reported daily during the peak of the epidemic in late April. Nationally, we tested over 254,000 people across the country this last week alone, which is the highest number of people tested in any 1 week to date. Yet, despite the high level of testing, national case counts continue to decline, and this is good news. The number of deaths will, of course, always be too high, but we have seen a significant decline in the daily number of deaths reported from a peak average of 177 deaths reported daily in early May to an average of 39 deaths reported daily over the past 7 days. Our collective hard work is paying off, and it's encouraging that we are observing declines in case counts across all age groups in Canada, and that the steepest declines have occurred among the oldest age groups, who are at most risk for severe outcomes. Going forward, a top priority for Canadians of all ages must be to keep COVID-19 away from older adults and other high-risk populations. As I said, we cannot prevent every death, but we must prevent every death we can. It's our responsibility to protect the most vulnerable in our society, and we must not take this responsibility lightly, as we have all seen what this disease can do. That brings me to the other end of the age spectrum. Nationally, young people make up a larger proportion of recent cases. Younger age groups are often more mobile and may be going out more and socialising in groups, all of which will increase their likelihood of coming into contact with the virus. And while younger people may not be getting as sick, it doesn't mean that they are not capable of spreading the virus. Everyone needs to be aware that no one is immune to serious illness with COVID-19, and anyone can spread the infection, exposing and endangering the lives of many others. The virus is still circulating in Canada, and new cases can emerge in any part of the country. As we head into another weekend, I urge Canadians of all ages to go out smart. Outdoor spaces are better than indoor ones, and fewer people is better than more. And frequent hand washing is a must. Wherever you go, keep your 2-metre virtual bubble around you for optimal physical distancing. And wear a mask when and where you can't keep that distance. Thank you kindly.
Merci, Dr. Knou. Et on est maintenant prêt.
Thank you, Doctor. We're now prepared to answer your questions. Thank you very much.
Before turning to the room, one question, one follow-up. Operator, next to you. Over to you.
Thank you. Merci. Our first question, notre première question nous vient de Raymond Fillon avec TVA. Please go ahead. À vous la parole.
Oui, bonjour.
Yes, question for Ms. Freeland. There was a report this morning that talks about a government order authorising 3 cities in Canada to allow the National Hockey League to, in fact, to go there. What is your response to that? Question. Response. The government is on the front lines, on the ground. Our professional healthcare experts have had good conversations with the NHL, and the chief medical officers of the provinces, Alberta, BC and Ontario, have also held discussions with the National League. And the NHL's plan has been approved. Now, I'd like to stress that it will be crucial for not only the NHL, but also players themselves to continue to work closely alongside our medical experts and to follow their instructions to the letter. And perhaps the doctors would like to add something to that. Before that, I'd like to thank BC, Alberta, Ontario for their cooperation with the federal government. Doctors? Well, I don't have much to add. Indeed, we have had good discussions with our counterparts in the provinces and territories. And of course, there are technical issues and logistics ones that needs to be taken into consideration. What we do all agree on is that the plan that's been put forward contains all the public health measures to protect not only the players, but their entourage, as well as Canadian general public from coast to coast to coast. Thank you.
Raymond, suivi?
A follow-up question? Apparently, there are about 40 co-ops. Please hold the line, Raymond.
Comment ça va fonctionner?
Est-ce que je peux me répéter en anglais?
Mayor, can I ask my follow-up question because I have to leave and I just would like to get my question out of the way. So what about this 40 cohorts and what prerequisites and conditions will the league have to meet? Response. Well, thank you very much. And I'll repeat what I say now in English after responding to your second question in both French and in English.
Our Chief Public Health Officer of Canada, as well as the public health officers of Alberta, British Columbia, Ontario, and Toronto, have been working very carefully with the NHL. And the public health officers have, through that close collaboration, approved the plan that the NHL has put forward for a safe return to play. I want to emphasize that it will be very important for the NHL and for players to continue to work very closely with public health officers and to follow all of their instructions. This is essential for the health and safety of the players, who I know we all have a lot of affection for, and also for the health and safety of all Canadians. And I would like to really underscore my gratitude to the public health officials of Alberta, BC, and Ontario, and Toronto, including Toronto, for their hard, careful, and diligent work on this. And maybe in English, Dr. Tam would like to say something.
Yeah, so protecting the safety of Canadians is the most important objective. And absolutely, the key is for local medical officers and the province to have thoroughly reviewed the proposals. And there are different stages and phases in the training all the way up to the actual games in the hub. And there are different measures at every stage to ensure that there are appropriate screening, testing, and the quarantine in groups, if you like, that would ensure that there is no impact to the local population. But of course, these things have to be reviewed all the time because even the activity of COVID-19 is changing, but also in other areas of the United States. So all of this has to be taken into account as well. But I think that the collective review is that there are very, very robust protocols that are being proposed. In addition, there is to be no impact on the actual resources, like testing resources, on the local community as well.
Et Raymond, merci, Dr. Tan.
Thank you, Doctor. And Raymond, as far as the second question is concerned, as Dr. Tan just explained, in cooperation with Canada's provincial, territorial and city public health officers and officials, the NHL has proposed a group quarantine approach. Now, as Dr. Tan indicated, this kind of group quarantine approach would involve regular screening and the provincial medical officers' directives be followed to the letter. And as Dr. Tan also said, this will be ongoing on a daily and hourly basis because conditions may change over time. Perhaps the doctor would like to add something?
Raymond.
Thank you, Raymond.
Première ministre.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Jim Bronsko with the Canadian Press. Please go ahead. À vous la parole.
Yes, for Dr. Tan. What do you think is the appropriate and safest way to handle it if an NHL player or another pro sports team member tests positive for COVID-19 in Canada?
Yeah, so the underlying principle is that those protocols must be worked out with the local medical officer of health. That's the primary approach. And that, if there was a positive test identification, that is linked to the local public health response. And so I think that's the critical aspect of it. And through the protocol, which as we said, is continuously reviewed. The idea is that through regular testing to reduce the actual impact to the number of people that would have to be sort of removed from the game itself. But again, I think that ultimately the decision has to be based on the public health assessment at the time as well.
Jim, follow up.
Yes, for Ms. Freeland. Is the government prepared to help bail out the Canadian Football League?
Thank you for the question, Jim. And let me just say that the government is very aware that a number of, that many Canadians are being hard hit by the economic impact of the health measures we've taken in response to the coronavirus. I think it's clear that entertainment and tourism are particularly hard hit for obvious reasons. And as a government, these are issues that we are constantly reviewing and looking into. Thank you.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question, nous vient de Lina Dib avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour.
Yes, hello. The question is for you, Ms. Freeland, about the Premier's call yesterday. And it's my understanding that it did take place, as usual. And Mr. Trudeau said in English specifically,
Be able to start bringing some good news for certain areas soon. Alors, j'en comprends que.
So my takeaway from that is that some provinces are ready, but I imagine Quebec isn't one of those.
Lina, oui, j'étais.
Response. Thank you very much, Lina. Yes, I was alongside the Prime Minister for the 14th teleconference with the provincial and territorial premiers. So a First Minister's teleconference. And I can tell you that there have been 14 teleconferences on a weekly basis until now. Now, this speaks to the level of collaboration between the federal government, the provinces and territories. And I think that it's the first time that there's been a weekly call, 14 in a row, in Canada's history. So it's historic. Now, perhaps I'm mistaken there. But this is indeed an extraordinary moment for our country, an extraordinary opportunity for a very close collaborative process. Now, yesterday, Mr. Trudeau and I had a very open, transparent conversation. We talked about the concrete hazards and any potential pitfalls as to a safe reopening of the economy. And we want to ensure that any restart is safe. And the federal government has earmarked $14 billion for this restart is in fact a safe one. We still have our work cut out for us. The Prime Minister is right in saying that there has been a very constructive, collaborative dialogue thus far, and it may very well be possible to move forward and continue discussions over upcoming days. Follow up. Well, to continue in the same vein over the next couple of days, but Prime Minister Trudeau said there's good news for some regions, but the flip side of that is that some provinces are meeting and exceeding these expectations and others not so much. So apparently, or I would imagine that the provinces that need this $14 billion will get the lion's share of it. Response. Thank you very much for the question. What I can say is that it was the First Minister's teleconference yesterday. Each province and territory has its own particular set of issues and difficulties that it faces. And what I can tell you is that it was a fulsome discussion with each and every province and territory. Now, I'm an optimist, and it is my indeed fond hope that the outcome will be positive for each and every province and territory in Canada.
Merci, Madame la Vice-Première Ministre. We will now turn to the room. Ian, Ashley. Who goes first? Ashley.
Good afternoon, Ashley Works, CBC News. Minister Freeland, as Deputy Minister Freeland, what's your reaction that MP Marwan Tabera, he went through the process that Liberals have in terms of allegations for sexual assault. They did find that some of those claims were substantiated, yet the party allowed him to run in the 2019 election. What's your reaction and what needs to happen moving forward?
I know that the Prime Minister has spoken about this today and previously. I think we are all disappointed that the party and the government wasn't informed when the recent issues first emerged. And beyond that, we take all of these allegations extremely seriously as a government, as a political party. They are being looked into very seriously and carefully. These are about people and people's lives, and so I think it's important to preserve confidentiality. So I can't say anything more than that.
In the past, Minister Haidu, as well as the government, has gone as far as saying that there is a crisis when it comes to harassment on Parliament Hill. And your government has fought for anti-harassment policies. It's been a big priority. What does it say, and how does it he who's now has these claims that have been substantiated about sexual harassment, was allowed to run, and is now facing criminal charges? How does that reflect on your government's efforts?
Look, let me just be very take take the reality of sexual harassment very, very seriously. We're a feminist government, and we know how important these issues are. The case that you refer to is very disappointing and troubling for us all. It is being investigated very carefully by us now.
Ian Wood, CTV News. Deputy Prime Minister, many of Canada's major grocery chains, which were offering their employees pandemic pay or an additional pay increase during the pandemic, have started to claw back that pay that they're giving their employees. MPs have called for the change to appear before a committee. I'm just wondering, is this time to reflect upon, and will you be reflecting upon whether or not these companies receive any future funding or access to programs because of this clawback?
Look, let me start off by saying I hope that one of the things that this pandemic has taught us is that people who do some of the work which is most essential for our literal survival are among the lowest paid people in our country. And I think the coronavirus has taught us how much we depend on them. And I think and hope the coronavirus has also taught us to be really grateful to them, because at the height of the health crisis, essential workers across the country came out and went to work. People working in grocery stores came out and worked so that we would be able to keep food in our fridges and on our tables. And I'm sure that was very frightening for many of them. And I personally am really grateful to the people in my local grocery stores, and I've told them that. I do think that it behooves us all, including employers, not to forget that lesson. I would also say that I certainly hear in the House, concerns about how the support that our government has offered to Canadians who are unable to work right now because of the coronavirus, or to Canadians who are unable to work because our economy is in crisis and the jobs are not all there. We've offered generous support. We've now said that we will continue to offer that support. And I do get questions in the House about whether that support constitutes a disincentive to work. I think the fact that grocery stores now feel able to bring the wages back down suggests that there isn't a powerful disincentive to work out there. And that is a reminder to us all that supporting Canadian workers and supporting the Canadians who can't find jobs right now is a really essential thing to do.
And on the two Michaels, this suggests a further downward slide in our relationship with China. You were foreign minister for many years. You're deputy prime minister now. Looking at our relationship with China, is it time to reevaluate how we interact with that country?
I'm grateful to you, Ian, for asking that question. I was heartbroken, and I was really angry when I learned of the latest developments with the two Michaels. I have spent time working with their families. I know them. And I would like to start by saying to the families and to the two Michaels that we are working hard for you every day. We think of you every day. And I hope I can say on behalf of Canadians, Michael Kovrig and Michael Spavor are two very brave Canadians who are behaving with incredible decency, incredible courage in difficult circumstances, in which they have been placed absolutely through no fault of their own. And I want to assure them in the strongest possible terms that we will not rest until they are able to come home. I want to assure them that, truly this is a whole of government effort to work on their behalf. We are continuing to do that. And I would like to really emphasize specifically how important it is essential to restore consular access to the two Michaels. Thank you. What I think is really important to focus on today, and with regard to China, is to communicate really clearly how important the two Michaels are to Canada, that they are a priority for Canadian foreign policy in general. They are a priority for our government in general. They are not forgotten, and we are going to continue to work very, very hard for their release.
Est-ce que je pourrais vous demander de répéter en
Could I ask you to repeat the answer in French, please, Ms. Deputy Prime Minister? Yes, of course. It'd be my pleasure to do so. As far as Michael Kovrig and Michael Spavor are concerned, I'd like to start by saying that I was terribly disappointed and, personally speaking, angry when I was informed of this news from this week in particular. I'd like to start by saying to Michael Kovrig and Michael Spovik's families that we are there for you. We're also there for both Michaels. Canada is going to continue to work on their behalf. And I'd also like to say that I have a great deal of admiration for both families. I also admire Michael Kovrig and Michael Spavor. These are Canadians who are both courageous and honourable. And let me tell them directly that Canada is there for you, and we will continue to work hard on your behalf. It is one of our government's top priorities. It is a priority that underpins all of our policies. It must remain so. And I think I can also say that it's a priority for all Canadians.
Minister, ceci met fin à la conférence de presse pour aujourd'hui. Thanks, everyone.